Well, welcome everyone again to our survivorship session. So we have 3 of our panelists from this morning joining us, Laura Kahn, Dr. Mella Davis, Dr. Jula Veerapong. And before we get into the panel discussion hosted by our very own Lindsay Barad, Laura is going to go through just a brief presentation on some coping strategies. So Laura, I'll turn it over to you.
Thank you. Okay, good. That's on. Wow. Well, so I've learned a ton today. It has just been so special talking with many of you and just hearing everybody's stories and just being kind of a little bit more immersed in this community. This is my first PMP Pals event. I would love to come back at some point if you'll have me. Anxiety. I think this is something that everybody in this room can relate to. I think we, as a psychotherapist, this is something I talk to my patients about all day, every day. So y'all are not alone if you feel anxious, nervous, a sense of dread, uncertainty, or fear of uncertainty. This is I would say this is an extremely normal and expected range of emotions to feel when you're going through something like y'all are going through. So this is by no means a comprehensive or exhaustive sort of list of how to deal with anxiety, but here's some places to start with it. Coping skills. So starting off with some of the basics, deep breathing. By the way, I would encourage you guys, take any of these that you're interested in and then take it to YouTube and you'll find guided practice for any of these skills. So if you need, to kind of have a visual for how to do this or some more practice, please take it to YouTube. It's a great resource. Or if you go to therapy, take it into your therapist, practice it together. But deep breathing, really when we're talking about deep breathing, we're really trying to, get that breath down into our diaphragm. Most of the time we're just breathing into our chest, somewhat, shallow, but we really want to kind of drop that breath further down, expand our belly like we're blowing up a balloon, and then letting that back out again. That helps kind of reset our nervous system, helps us cope and kind of de-escalate that anxiety. Grounding techniques, which we have a one that we're going to walk through together. This is something that grounding techniques is anything that helps you kind of ground yourself in the present moment. A lot of times when we feel anxious, our thoughts start racing and we start thinking about the past or the future. We're not in the present. We might not even be in our body very much. We're so in our head. Let's try to drop our focus down to our full body and tune into our environment that's immediately around us. So that's grounding. Mindfulness meditation. It's another related skill called dropping the anchor that we'll talk about here in a moment. Mindfulness meditation, it's a practice. It is something that our brains are not naturally designed to do. It takes a lot of practice because we have, a million thoughts a day, right? And so mindfulness is kind of taking a moment just to kind of pause and notice thoughts that are coming up, feelings that are coming up, remaining out of judgment of those thoughts and feelings, and keeping your focus back to the present moment, your breath, your feet on the floor, your back against your chair, just kind of, attuning to what's going on around you and inside your body, non-judgmentally. Progressive muscle relaxation is a skill where basically you go from head to toe and you tense your muscles really, really tight and then release. So I'll do it here with my, you can clench your jaw really tight and then release. And you feel that difference between tensing, causing more tension there and then releasing. And you notice, oh, this is what it feels like to relax that part of my body. So when we tighten it, you can even do it with your hands. You make a fist really tight and then you let go. Really pay attention to what that feels like, the letting go and the relaxation, so that you can kind of, oh, okay, wow, I was really carrying a lot of tension in my jaw, in my neck, my shoulders, go like this, and then let it go, So you can do that head to toe. Gratitude journaling. Gratitude goes a long way at helping us kind of build resilience and cope with anxiety and difficult emotions. Movement, like exercise, walking, it can be very low impact, not super intense, but just some sort of movement can be stretching, can be very, very helpful, or chair yoga, something like that. Using art, music, crafting, getting into something creative can go a long way at helping us ease anxious moments. Spend time in nature, get outside if you can. Limit stimulants. This is a big one, and this is hard. For me, caffeine, sugar, screen time, I think that's probably, we're exposed to all of that. We're flooded with that all day, every day. But those things can make anxiety worse. So just be mindful of, okay, let me not reach for that fourth cup of coffee right now in this moment. I'm already anxious enough. Or, let me look at my sugar. What can I do? Can I turn my phone off or kind of reduce my screen time a little bit? Talk to someone you trust. That's key, someone you trust. Not everybody kind of has, earned the right to, hear what concerns you have, and hear, not everybody is someone you can be vulnerable in front of. So if you can talk to somebody that you trust about how you're feeling, that can be helpful. Get their support, or, or ask for help from others. So if that's your care team, if it's a friend, a relative, support group, support community like this, asking for help certainly helps anxiety. So there's a particular skill that was developed sort of through acceptance and commitment therapy. It's a particular kind of therapy that we find can be really, really helpful at treating anxiety. It's a skill it's called dropping the anchor. It's a skill that helps us commit to tuning into the present moment, so using mindfulness. And it helps us tune into our body and our surroundings. So kind of a way to engage in the present moment is by coming back into our body and engaging in our immediate surroundings, so that we're not kind of focused on the past or the future, we're here in the present. And it helps us drop the struggle against our fears, because that's what sometimes makes anxiety worse. We feel afraid of something, and then we get into this huge, back and forth in our head. Our thoughts really run away from us. What if? How will? When will? But, like kind of this debate within yourself of, how you feel and what's going to happen next, and how should you feel, and how do I get back to a place of feeling safe? And all of that is a big struggle sometimes. So this skill can help us kind of drop that struggle, even if just momentarily. So that skill of dropping the anchor, it follows this acronym called ACE, just to help you remember the 3 steps of it. So A stands for acknowledge feelings. So let's, when you notice feeling afraid, let's acknowledge that. And you can say it out loud, or just in your own mind. I'm feeling scared right now. I'm feeling anxious right now. I'm feeling overwhelmed. Name that feeling so that you can recognize, okay, I'm in fear right now. C stands for come back into your body, and that is turning your attention back to your physical sensations. So you can go, again, kind of head to toe of, okay, what do I feel right now? All right, top of my head, okay, all right, I'm okay there. Feel, drop it down my eyebrows. Okay, I'm holding tension in my eyebrows. Bring my focus to my jaw. What's my jaw doing? Am I clenched? What's happening there? My neck, can I go like this and just kind of change up the sensation there for a second? What are my shoulders doing? Are they all the way up here? Well, that's going to keep me in fear. Our body reacts to, our posture, our stance can also kind of perpetuate emotions that we feel. So if we change up our stance and go into a relaxed position, that can break up the fear as well. And just keep going down your body. What's happening in my abdomen? What's happening with my breath? Am I really shallow? Is my heart rate going up? What's happening in my chest? Okay, can I take a deep breath and bring that down into my belly? All the way down to your feet. And then lastly, E is engage in your environment, which is really tuning into what's going on around you. So one thing that we can do to help us engage in our environment, actually 5 things you can do. This is called 5, 4, 3, 2, 1 grounding technique. And just a caveat to this. This, of course, kind of traditionally talks about our 5 senses, sight, touch, hearing, smelling, tasting. But if you don't have, kind of full access to all of your senses, that's okay. You can totally modify this. It doesn't have to be all 5. If if your taste buds are affected, maybe by chemo, if your sense of touch is affected by neuropathy, if you can't see, clearly or whatever, that's okay. You can modify this to 4, 3, 2, 1 or 3, 2, 1 and so on. But assuming that you have access to all 5 of your senses, in order to connect with the present moment, you can pause for a moment and look around, and you just name 5 things that you can see in your immediate surroundings. The water pitcher, the projector, the light fixtures, Lindsay, my handouts, right? So 5 things. 4 things that you can touch in that present moment. And that's, feel. So, okay, what can I touch? All right, so I feel the weight of the microphone in my hand. I feel my glasses on the bridge of my nose. Just had a little itch right here. Oh, I know, a little itch sensation. And then I feel my back supported against the chair. 3 things that you can hear. This can be a challenge sometimes. I hear kind of like a whirring, either AC or whatever. I hear my voice. I just heard a rustling of paper over there, so whatever you can hear in the moment. 2 things that you can smell. This one gets challenging for me. I don't really smell. So you guys, please, do whatever, whatever you can smell in the moment. I won't, use that as an example right now. One thing, it smells like a conference room, I don't know. It just smells, whatever. If we did this in the morning, it would probably smell like coffee or something. One thing you can taste. So, that also can be challenging too if you, haven't had like a sip of something or a mint or, your toothpaste from the morning or whatever, but something that you can taste in that present moment. So that's 5, 4, 3, 2, 1 grounding. And then I'll end here with just a quote that has really guided basically my entire approach to psychotherapy. This quote has really shaped everything that I do, and kind of how I see, how we deal with things, which is a quote from Robert Frost in one of his works. He said, "The best way out is always through." And, I think, we can't go over it, can't go under it, can't go around it. We have to go through what we're feeling, through the fear. We got to acknowledge it and walk through it in order to get to the other side of it. We don't need to avoid, we don't need to minimize, we don't need to pretend that it's not happening. We can walk right up to it, shake its hand, walk with it, and keep going. So I hope that, like, dropping the anchor and the 5, 4, 3, 2, 1, I hope that those 2 skills are kind of a way to help you walk through it in a way. And later on, I've got handouts up here for you guys to take that kind of reminds you of each of those skills. That's all I got. Thank you.
That's a really good presentation, very good talk, because, mindfulness and stress and anxiety reduction, I think, is really a big component of prehabilitation and rehabilitation. And mindfulness really can come in so many forms. I mean, you don't have to be able to do, like, be in half lotus and, and hold a pose for like 20 minutes to be mindful. It can just occur anytime during the day, whether it's going for a walk or a run, a drive. You can stand and meditate. You can, sit at your desk and meditate for like 5 minutes. Or if you need a little guidance, you can do some guided meditation. Like, there are a lot of apps, like, say, like Buddhify is one of them, where, you kind of pick a situation where you're in. Like, I'm on a plane, and you can pick that guided meditation, and it kind of walks you through. And you don't necessarily have to be super still, but it's all about kind of feeling yourself in the moment and connecting with yourself in the moment, I think.
Thank you. Okay.
Okay, there we go. So since the theme of this panel is survivorship, I would love to hear what survivorship means to each of you individually.
I do want to make a comment. Before I see, I use mindfulness too, but what I do is I breathe into my head and pray for wisdom, I breathe into my heart and pray for love, and I breathe into my abdomen and pray for resilience. So whenever I'm facing something stressful, if I just take those times, I kind of settle down. So I appreciate very much. So one thing that I learned very early, and I was taught by a surgeon, believe it or not, my land, I was doing my first paper about 43 years ago on a disease called carcinosarcoma of the lung, which was relatively unusual. And I was doing this at the Mayo Clinic, and I was doing this with a very good surgeon by the name of Peter Perolero. And as I was writing this paper, I used cases. We had 13 cases. And he immediately corrected me and he said, no, these are persons. So one of the things that has always bothered me is you're not a cancer patient, you're not a breast cancer patient, you're not a pancreatic cancer patient. You may be Jenny who has, a peritoneal carcinoma, but you're much more than your cancer. And, obviously we're at a meeting of cancer survivors, but remember that you're really a person. I mean, we belong to a group, but it's very important. And unfortunately, physicians and people in the medical will tend to categorize people by disease, because medical education, I was brought up with it, was disease-oriented, not so much person-oriented, but was disease-oriented. So we talked about stage of disease. This patient had stage 3 lung cancer, and so they were identified by that, and that was helpful if one was treating disease, but you often lose the person. So, if your physician says, oh, you're a peritoneal carcinoma patient, correct him. No, I am Ed, and I happen to have a peritoneal carcinoma. So cancer survivorship can be the same. I'm a cancer survivor. No, I may be Betty, who also is, surviving cancer. So.
I guess from a technical standpoint, when I think of survivorship in the sense of maybe the Commission on Cancer, it typically connotes someone who's gone through a treatment and then after a certain amount of time doesn't require any more active, or proactive scans or staging to monitor for cancer. But really, I think survivorship is a spectrum. I think it just begins from day one, from when you're diagnosed, in my opinion. Because the whole journey of cancer treatment, it's really about being a survivor, and sometimes everyone has different journeys and different obstacles, and everyone's journey ends at a different point. But ultimately, I think the mindset is such that you're surviving this really tough thing that you're going through. So that's really kind of my mindset. But it's not always the classic term, I would say.
I totally agree with what they both just said. And I really appreciate that it's, we definitely kind of label as humans. We like to label ourselves or label conditions, or, that's just a way that we make sense of the world, and we need to do that. They're useful labels a lot of the time. But yes, that we are, that we are people first, and that this is a journey. I think people ask me a lot, when will I feel like I've, reached the end of this? When do I become a survivor? And so I appreciate, what you said of, that it starts on day one, essentially. And, kind of, it makes me think of the concept of like becoming the person that you were meant to be, that it is kind of a transformation and allowing yourself to go through the highs and lows of that and, the uncertainty of that. I don't know what version of myself I'm becoming, but, I'm willing to approach it with trust, faith, my family, love, hope, whatever, you value. That's sort of how we move through and become a survivor.
Yeah, I really feel like you all are survivors regardless of what part of the journey you're at. I mean, you're all here.
That's a great segue to our next question. Something that we talk about often as I was going to say patients, as survivors, and Dr. Veerapong, I think you were the first one who brought this up in this morning's panel, is navigating our new normal. So from your perspective, how would you recommend us as patients, us as survivors, how do we navigate this new normal?
Do you want to go first?
Go ahead.
I think, I think you guys are all kind of navigating the new normal. You guys are here, you guys are sharing your experiences together, and you guys are understanding what this new normal is. And kind of sharing not only your uniqueness, but like I said in the prior session, the commonalities. And just understanding that you're not alone in this process, and that this is not like, this is, other people are experiencing this, and from other people I can learn maybe how to navigate or understand what is coming around the corner, and maybe be able to navigate that better than the person who had said, this is what I experienced. They can give you a little bit of a warning about their experiences, and then you can maybe have less of a time of adversity than other colleagues who have gone through what you've gone through. But yeah.
The new normal can be positive and it can be negative in that sense. So the positive is my quality of life is much better, and some people become overtly honest and they don't put up with crap, and because of what they've been through, and they know what they've been through. And it also can involve symptoms like fatigue and pain related to treatment. That's part of the new normal. And learning to live with that can be a difficult journey with it. And, you may run into a physician who says, well, you ought to be lucky you're alive. But again, I think that's not looking at the person. There's a wonderful, I think, definition of suffering. There are a lot of definitions. But Eric Cassell said that suffering is a loss of a sense of self. So survivorship is regaining a sense of self, but it is a new normal. It's a new, it may be a new role. It may be a new way of looking at things. It also can be new symptoms, but awareness of who you are as a person. So a lot of what we do in palliative medicine is to recognize the person and to help them gain a sense of who they are, of that they are important, and that their symptoms, even in survivorship, are important, as far as managing and helping people gain a sense of themselves. There are techniques that I use, for instance, some of this I use with families, particularly in people who are fairly ill, is reminiscing. Reminiscing is a good way of reducing, particularly if you're dealing with a relative at the end of life or so, reminiscing, being able to remember vacations, who that person is. I actually wrote some poems on reminiscing, and I lost a good friend recently and was teaching the group to use reminiscing. So, but that's regaining a sense of oneself, of, having legacy. That's the other potential thing that can be really quite helpful.
Yes, I totally agree with what's been shared already. And, I think it's so jarring. I think what people have a hard time adjusting to is going through something new and different. Our brains don't like that. We don't like new and different. We like predictable, we like safety, we like familiar. So, it's completely understandable to feel like you're struggling, or even wonder, like, am I the only one struggling getting through this? Because you might see somebody else at the cancer center, or, in the news or media or whatever, of like, oh, they seem to be coping really well with their cancer and this surgery outcome, and, their new, abilities, all of that. You're not abnormal for finding it difficult, or feeling like, you're struggling with changes that you experience as you, move into survivorship and continue to evolve with that. And using skills like dropping the anchor, the grounding techniques and mindfulness can be really powerful at just noticing where you are, what feelings you are having, practicing staying out of judging those feelings, because they're not right, wrong, good or bad. They are what they are. We have feelings for a reason. And it's completely normal to feel new and, and challenged by the changes that you experience. Yes.
Yeah, and the other thing too is, the new normal is, understanding that you're maybe not necessarily the same person that you are when you started the journey. You are a different person, perhaps, more resilient, and an understanding of, what are your goals and the things that really spark joy in you.
For sure. Part of this new normal and the uncertainty that you just mentioned, we all have what we call scanxiety. How do you recommend we cope with this? We learned some great coping skills from you, but from your perspective, how do we deal with this uncertainty in our new normal when we're on surveillance for, as we talked about earlier, several years or the rest of our lives?
Yeah, scanxiety is a real thing, and it occurs for me as a doctor as well, because anytime I see you back in clinic, I'm checking the scans and looking at it and checking the tumor markers, and I always want it to be a very happy conversation, and maybe a super boring conversation of like how you've been doing, the last 6 months, anything new. But yeah, I think you hit the nail on the head. Really, the whole idea of scanxiety is that uncertainty. And I think it's about trying to just deal with the uncertainty head on. So, okay, what does it mean if I have a little spot or what does it mean if I have a fluid collection 6 months after surgery? Probably nothing. So, probably nothing. What does it mean if a fluid collection gets bigger that is known? Probably nothing. So it's just about kind of understanding and maybe tackling it head on. Okay, what if this spot gets bigger? Well, maybe it's something. What do we do? Then maybe we'll figure out something like do a laparoscopy to work it up. So I think it's about kind of understanding what a scan will mean. And I think by understanding that, it kind of helps a little bit with the scanxiety.
As an oncologist, I avoided scans in December, unless you had to. But that was the trick that we did, to avoid scans anxiety. I mean, I'm a 15-year survivor, and yet every time I see an internist, they still, want to, check. And I go through my feelings about that, and I said, I feel just as fine now. Why should I have anxiety? Why should I feel any different getting a blood study or whatever test is done? But those are real feelings, and obviously there's a sense of relief when it's normal. But I think it's difficult, and I think even more now that people have access and should have access to their scans, and they read them online, and it's very hard to understand what a radiologist sometimes says. You have this longer period of anxiety waiting for the physician to call you to inform you that it really is okay, this is what he was really saying, or whatever, or there's an abnormality here that may be a concern, and we're going to repeat the scan in 3 months for it. So having access, which is, I think, important, being able to see your own scans, but also being able to interpret them, has probably increased anxiety I came from an old school. At one time when we were, for instance, doing breast cancer, we did bone scans every 3 months. This was probably before they were both born, but we did frequent scans in people who were asymptomatic, and the philosophy dramatically changed to the point that why get a scan if someone is feeling good and doing well, if, for instance, it isn't going to change the long-term outcome. And, that's difficult it makes a lot of sense to me, but it's very difficult because the patient also wants to be reassured that they're okay, and the other is being a survivor. Any symptom that you get, whether it's bone pain or nausea, is recurrence of cancer until proven otherwise. And being an oncologist, all my kids, when they ever had symptoms, it couldn't be anything else but cancer, right? Because that's in the forepart of your brain. But it's more likely that any symptom that you're going to get in survivorship is likely not to be your cancer, but may be something else that's going on, but certainly should be scanned or screened for that. Those are particularly my thoughts.
Actually, it's a really good point because there's no data to show that more intense scanning affects survivorship. Really what it does is it begets more anxiety, and it begets more, a lot of times, unnecessary workup. I guess the thought that came up when I was thinking just now is to try to mitigate scan anxiety. I usually go, it's hard, you're right, because a radiologist, they just have to say it's possibly this, and this, and I'm like, oh my gosh. But going over the scan, physically, and looking, I usually use the coronal scan, where you can kind of see a face-to-face, and this is your spleen, this is your, some of you don't have your spleen, but this is your stomach, your liver, your kidneys, but go through all of it so that you can kind of understand oh, this is the thing that they're looking at, this spot in the lung, I can't even find that spot in the lung, anyways.
I think something that our anxiety does for us, because all of our emotions, they serve a purpose. They're data, they're information for us. Anxiety can help motivate us to take action towards something. It can be the thing, instead of letting your health just kind of go to the wayside for years and years and years, we need a healthy dose of anxiety to be like, I am going to go to that doctor's appointment. I am going to do this lab work. I am going to go to that scan and see what's going on and confront it. So we need, so anxiety is not the bad guy necessarily, but I can so understand it can feel like it gets out of control sometimes. And that part of dealing with anxiety, what scares us the most, I think, is the idea that I won't be able to handle this. I won't be able to handle X, Y, and Z. There's no way. If something comes from a scan that's, if it's anything other than clear, I won't be able to handle the fear, the sadness, the loss, the uncertainty. That's what anxiety is telling you, like, nope, get in front of this. Don't, we cannot handle what's going to come next. And the good news is that you actually can, because you have handled everything all the way up till this point, till this moment right now. And so just recognize you're going to have those feelings. It's understandable and normal. And certainly if it's getting in the way of your life, if it's where you can't sleep, you're not eating, you can't concentrate, you are withdrawing from your loved ones, or doing, not doing things that make you feel like yourself. If it's persistent and relentless, definitely speak up about it. Talk to your doctors about it. See what they can offer to reassure you. Go to therapy, and come up with coping skills, but also kind of, some other tools and things to help you realize, like, I can handle this. I'm going to grow that muscle as a skill. The other way around, that skill as a muscle. Anyway, you know what I mean.
Another common feeling that a lot of us have as survivors, we feel overwhelmed, and we also often feel unheard by our providers. How would you encourage us to advocate for ourselves when we're feeling overwhelmed or feeling like we're being unheard by our doctors?
I think that's a difficult issue, and what I try to do in a patient interview is actually be silent and listen to what's going on. And sometimes it's hard. I have to admit, I had a patient that called. She was so anxious. And her, we went over her symptom. It was difficult to pinpoint it. But she said, I feel unheard by physicians. So that really increases the suffering. And eventually we came to a mutual decision of what needed to be done. But it took some time, and having her calm down and listening to that. And sometimes that's a difficult skill for physicians, because we're so used to getting things done. I'll give you this drug. This is easy. I will just go up on your pain medicine, or, this or that. We want to fix the situation, and sometimes it's better just to listen. And that's maybe the only thing a patient wants, is to be heard. And so we have these symptom scales that we use, and I said, we look at this, and, we can do this and this and that, and they'll say, no, I just want to tell you where I am, So they want to be heard, but the symptom may not need to be addressed, but they just want to be heard about that. So, the other is, what do I need to address with you? What's important to you at the moment? But it is difficult as a physician, because oftentimes we were made to fix things, and sometimes things don't need to be fixed, they just need to be heard.
Yeah, certainly very tough, because you probably, a lot of surgeons have strong personalities, and can be very busy. You may have been in clinic and they're running late, and but I think one of the things you could just say is, I feel unheard, and if a surgeon's not able to stop and absorb that, then, you know, that's problematic, I would say. But that is one way, just literally express, I feel unheard, or I really don't understand, or I need clarity. Something that, you know, it kind of, I'm thinking about the operating room where we have this catchphrase, I need clarity. It's supposed to be like a non-judgmental way of just being able to, whether you are, you know, a surgeon or anesthesiologist or a circulator, to kind of, you know, stop the line. But that's, I guess that'd be my suggestion, because if someone says to me, I feel unheard, then that would make me stop.
I think I just want to acknowledge too, this might be a little controversial, but I want to acknowledge that that must be really hard as a provider who wants to provide more time and a listening ear, but they're under really difficult constraints, time constraints. You know, I think probably all of us in this room have gone into, you know, let's say a primary care visit, and you spend 5 minutes with your doctor and then they're gone out of the room, and you can tell that they're just right on to the next person, because of the volume of patients and, you know, things that are out of their hand. It's not provider driven that they have that little time with you. It's external business related pressures put on them. And I think, fortunately, maybe in the oncology world, they are given a little bit more time. I also think that's somewhat, you know, based on the provider's style and what they advocate for, of like, I need an hour with my patient. 15 minutes does not cut it. I need an hour, you know. But I think that, you know, so when we're up against some of those additional constraints and systemic sort of issues, that can, you know, affect the patient-provider relationship. And I really appreciate, you know, what they've shared of, like, you know, vocalize that I just need to be heard today. You know, I don't need you to fix it. I just want you to listen. Providing feedback and revisiting that over time, you know, reminding your provider, this is more of what I need from you, because you might have the conversation once, and then the next visit they come in and it's kind of back to the way it was before, and it's like, keep reminding them over time, you know, I need you to listen, I need you to validate what I'm feeling, I don't need you to fix it in this moment.
One of the things that you can help, and I occasionally have a patient do this, bring your own list in. So, doctor, these are the 5 things I need clarity on. And that will help as far as time is concerned, because, you know, not being heard to a physician sets off an emotional thing, but coming in organized, look, these are the questions I have, if we can answer them. And he may not be able to get to them all, but you ought to be able to set up a time that we can answer those particular questions. So having a list of what you need is really very helpful, and will help as far as time is concerned, if there are time constraints.
And sometimes if you are not feeling like you can advocate for yourself, you can bring a tenacious family member, and a vocal and tenacious family member with a list.
Speaking of those family members, does everyone hear the laughing coming from there?
Yeah.
Like, what is? Yeah. So we have time for one more question, but I want to say, I think I could speak for a lot of us. Hearing the answer to that question, that last question, is very empowering for us as patients, because a common conversation that we have on our weekly Hope Zoom calls is people feel unheard and overwhelmed, and we are intimidated by our doctors, and we don't want to bother you, and we don't want you to be offended that we're getting a second opinion or questioning things. So I hope that everyone here just heard that and feels the same sense of empowerment that I do, because it's not easy to always come, you know, to come to you with questions like that.
That's why I don't wear a white coat and I sit, because a white coat puts distance between me and the patient, and it can be a Foucault power play, because you have this big thing across your chest. So I'd rather sit and and listen to someone without a white coat.
Did you have something?
I don't know if I don't even wear a white coat. I don't think I wear. This might be what you'd see me in clinic with usually a collared shirt and a jacket, you know. Yeah. I used to wear a suit and tie when I looked a lot younger, and everyone thought I was a student.
That's funny. So our last question, and again, we only have a few minutes, so we can keep the answers brief. We discussed earlier that we're all survivors. There's a spectrum of it. So what we often talk about is how you're recently diagnosed. You could be NED, which stands for no evidence of disease, but you're still on surveillance. Or you could be on active treatment, some people for the rest of their lives. What piece of advice would you give to survivors in each of these buckets?
I think living in the moment, oftentimes things like new diagnosis project us into the future, and we forget the moment that we're with our family, you know, and being with family is a gift, and being with the loved one is a gift, and oftentimes I know I take it for granted, you know, when I'm looking to the future or planning to the future. I'm probably notorious for not living in the moment, and with therapy, people count, you know, in 2 weeks and 3 weeks and things like that. But to remember to live today, you know, and make today count, or live for something today that gives your life meaning, I think is the important thing. So don't stop living while you're getting treatment, or don't stop living while you're, quote, a survivor. Continue to live.
That's a really good comment. I would echo that. The other thing too, in addition to living in the moment and enjoying, you know, what you have, is maybe set a goal, set mini goals. You know, I'm going to get myself through this. Okay, I have 6 cycles. You know, what am I going to do at the end of 6 cycles? But having a mini goal at each stage, I think, would be helpful, because that also sets an element of purpose as well.
I agree with what's already been said, and I mentioned a little bit about self-compassion earlier today. And just as best as you can, just be gentle on yourself. If you're, you know, I know all of you are patients, but you know, caregivers, whoever, you know, whoever you are in whatever stage you are of this process, you know, self-compassion is you know, going to be something that helps you feel your way through it, you know, remain connected with your loved ones, and adjust, you know, to the uncertainty that you all face.
I have one final comment. I know someone's really very healthy when they say to me, you know, after this visit, we're going to Chick-fil-A, and I'm really looking forward to that. So I know that they're probably living in the moment, or, you know.
Thank you guys so much. This was wonderful.